Before I got on IgG, I was actively dying.
Friday, Willette got a call from her pharmacy saying her insurance company, Wellmark, will not cover her prescription anymore.
No person middle class or lower class has $16,000 just sitting around.
I've been told that if you want to run for office in Iowa, you're allowed to talk about access to health care, but you're not supposed to bring up Wellmark.
The most important thing to us, everybody in this room, is their health care.
Given the fact that over the past 2 years they've had these huge increases, it's just unconscionable, it's outrageous, it shouldn't happen.
Wellmark has hiked premiums not once, but twice since the start of the pandemic, and it's not the first time they've done this.
Hugh Espy with Iowa Citizens for Community Improvement cites an 18% rate hike last year and an 8.5% increase this year.
But what does it actually mean to have access to healthcare? Any of us can access a Lamborghini dealership, but just because I'm allowed on the lot doesn't mean I can drive away with a car. Wellmark practically has a monopoly over Iowa's insurance. This results in more and more Iowans filling up emergency rooms because they can't afford the inflated copays and deductibles it takes to check in with a primary care doctor.
Patients often have little choice when they go to the emergency room, so they're kind of held hostage a little bit to whatever prices the emergency room wants to charge for the care.
It's overwhelmingly the most marginalized in our community who suffer when they can't afford out-of-pocket insurance costs.
According to the CDC, Black women are about 3 times more likely to die of pregnancy-related causes than white women. About 60% of pregnancy-related deaths are preventable.
And the numbers aren't better for their babies.
If we look at Black babies, they die at a higher rate than white babies.
I want politicians to stop talking about access and start demanding that our government deliver health care for all.
Every month, Chris Clemons pays twice as much for health insurance for her family of 4 than she does for the mortgage on their house.
You know, there's a lot of people that don't even make that much money a year, and then that's what we have to pay to have health insurance.
Wellmark may hold a near monopoly on Iowans' insurance coverage, but I'm not taking a dime of their money. That means I'm the only candidate in this race who won't balance the interests of my constituents against Wellmark's wishes. Please join me in the fight for health care for all Iowans. Thank you.